Language disorders in children with sensory deficits, specifically hearing impairments. My name is Chelsea Metcalf, and I have put this presentation together for my language disorders class at Tennessee State University. There are a number of questions that you as a parent may have about language disorders. Identifying risk factors as a toddler allows the opportunity for early intervention. What are these risk factors? A small vocabulary, not many verbs, and vowel errors are a few of the predictors and risk factors of a language delay. Or could it be something else? Do you have a family history of hearing loss? Did your child have a prolonged NICU stay or head injury? These are all risk factors for hearing loss. Predictors such as limited vocabulary or delayed or unclear speech could explain the language delay in children with hearing impairments. What exactly is a hearing impairment? A hearing impairment is when any part of the inner, middle, or outer ear is not working correctly. This is classified by type and degree of hearing loss. 3 types of hearing loss: conductive, sensory neural, or mixed. To understand these, we first need to look at how we hear. The sound comes in through the outer ear, travels to the middle ear, and then finally to the inner ear. A conductive hearing loss occurs in the outer or middle ear. This type of hearing loss can typically be corrected medically or surgically. Sensory neural hearing loss occurs in the inner ear. This type of hearing loss is typically permanent and is not usually corrected surgically or medically. With a mixed hearing loss, the individual has a combination of a conductive and sensory neural hearing loss. Hearing loss is also described by degrees: mild, moderate, severe, or profound. Degree of hearing loss tells the quietest sound that an individual can hear. A person with the profound hearing loss in the red cannot hear any of the sounds above the red box. Does a hearing loss have an effect on language development? It does. Hearing loss can cause a delay in speech and language, which can lead to learning problems, communication difficulties, and then impact the child's future. The vocabulary of a child with hearing loss develops more slowly. They may not be able to hear their own voices and speak too loudly or not loudly enough. Full-age children with hearing loss may struggle academically, especially in math and reading, which may lead to feelings of isolation. If you're thinking that your child might have a hearing loss, what should you do next? The first step should be consulting with your pediatrician and requesting a hearing screening as soon as possible. If your child does not pass the hearing screening, your pediatrician should refer you to an audiologist or ear, nose, and throat doctor for a full hearing test. If after the full hearing test your child is diagnosed with a hearing loss, talk to your doctors about treatment options and intervention services in your area. For more information about hearing loss, please visit the websites listed above. The earlier children with hearing loss start getting services, the more likely they are to reach their full potential. If you are a parent and you suspect your child has hearing loss, trust your instincts and speak with your child's doctor.